Hey guys, YouTube, what is going on? It's Evan again, your paramedic coach, and today what we're going to talk about is something powerful, all right? Today what we're going to talk about is altered mental status patients, okay? I want to talk to you guys today about some different things that you may see, and I have a cool mnemonic that I want to share with you guys today. The first mnemonic I'm going to share with you is this. The whole entire Paramedic Coach system, revolves around learning different mnemonics and also, as well, learning different pathways to treat patients, all right? So, I'll give you an example. When I first became a paramedic, I would have different systems in place. So, if whatever the patient's complaint was, I knew what I had to look for. I wasn't nervous about it, okay? There's enough going on when you're a brand new paramedic, and I want to offer you some cool tips today. So, we're going to go over today Evan's mnemonic for altered mental status. So check this out, guys. So first is split up into two different mnemonics, but if you want to bring them together, by all means, you may do that. So first mnemonic is Evan's 3 S's, okay? So what you can tell yourself is, okay, the patient's confused or altered. There's 3 S's that I'm going to look for, like an S, okay? Each one starts with an S. So, okay, they're confused. Okay, what are the 3 S's? Let's see if this is one of the 3 S's. So here it is. The first S you want to look at is stroke. So do a stroke scale on your patient, okay? Number 1, okay? Number 2, so the next thing you want to look at is, could it be sepsis, okay? What is sepsis going to look like? Well, obviously there's going to be some fever going on, okay? There's also going to be some tachycardia going on, and finally, if they're going south into shock, is going to be some sort of hypotension, all right? So sepsis is number 2, okay? The next S you want to look at is sugar, okay? So what is the patient's blood sugar, okay, blood glucose level, all right? So get a blood sugar on the patient, right? So that is what you want to look at. Now, after doing those 3 S's, so let's just say I do my 3 S's, okay? I'm going forward. I check for stroke, negative stroke scale. I did a blood sugar, it comes back at 80, clean, okay, good. We do the next thing, sepsis, no signs of sepsis, no recent infection. What are the 2 most common routes of infection? It's going to be pneumonia and also UTI are pretty common, okay? Cellulitis, okay, cool. You can think about that, but we're talking about sepsis and things like that. Really, we're looking at pneumonia and we're looking at UTI, okay? Now, next thing I want you to think about, you can think about this as a bonus S. What's the bonus S? Okay, it's common, is seizure. Okay, seizure. Do those first 3. If it's not one of those 3, I want you to think, as a bonus, could this be a seizure? Okay, there's many different types of seizures out there, okay, but could it be a seizure? Do they have a seizure history? Do they suffer from alcoholism? Okay, some of those things, okay, check that out. Now, if it's not one of those 4 S's, okay? You did your 3, you did your bonus for seizure. If it's not one of the 4, the next mnemonic is not, N-O-T. So N is going to stand for Narcan, okay? So N, what Narcan means, is this a simple opiate overdose? But also here with the N, I want you to think about, could this be an overdose or some sort of toxic emergency, okay? Is there medication at play here? So when I think of Narcan, I think of overdose, first thing. But could it be something else? Could it be alcohol? Could it be another drug, okay? So Narcan. O is for oxygen. Is this patient simply just hypoxic? So if we're doing our vitals, you're checking the pulse ox in the patient. If it's below 94%, well, if I'm hanging out and I'm sitting here and I'm at 85% oxygen, I'm going to be confused. So give me oxygen and watch. I'm going to be feeling a lot better and maybe not confused. Okay, respiratory emergency. That can keep you altered. And then finally, the T, and this mnemonic is going to be trauma. Is there sneaky trauma? Okay, give you an example. It's the winter time. Your patient has bundled up. But you don't notice that they're bleeding under their 3 layers of shirts. Or you have to take their hat off, they have a hat on, and there's a huge hematoma here, and their pupils are unequal. One's huge and dilated, and one is more constricted. That could be a head injury, okay? Maybe they're altered because they fell in the ice, or maybe they got hit with something, and they don't know what's going on because they're confused. Sneaky trauma, okay? Now, if you go through all of those, okay, and the vital signs are clean, good blood pressure, good heart rate, we already checked the sugar, good pulse ox, you do your physical exam, everything looks clean. At that point, we got to start thinking about, okay, maybe as a paramedic, maybe there's something going on in the blood work here. Okay. Maybe there's something going on internally that we can't see. This is why we're taking the patient to the hospital. All right. But you've covered your bases. I'll give you an example. If you brought a patient in suffering from a stroke and you went to the hospital, no lights and sirens, that's the problem. Okay. If you have a patient with a blood sugar of 40 and you missed it, a problem. The whole goal of being a paramedic is to catch life threats early, treat them if we can. If we cannot, we alert the hospital immediately. Hey, I got a life threat here. Okay, it's something that we can't manage, meaning they need a surgery or they need some sort of procedure that we can't do in the field. But it's coming, and we're coming in quick. We're setting you up with IVs. We're setting you up with all the bases. We'll see you in the critical room. All right. So that is altered mental status. Hope you guys enjoyed this lecture. And guys, if you're new to the channel, be sure to subscribe. Again, my name is Evan, the Paramedic Coach. And if you want to learn more, if you love these videos, there's going to be a link down below. We call it the Paramedic Coach system, the Paramedic Coach course. If you want to learn how I treat patients, if you want to learn the skills that got me to be a expert, a confident paramedic in my system, click the link down below and you're going to learn a lot. And guys, I'll see you next time.